Hello, welcome to the second session on clinical manifestations of tuberculosis. I am Dr. Deena, scientist working at the National Institute for Research in Tuberculosis, Indian Council of Medical Research. In the first session, my colleague Dr. Poorna had talked about the clinical manifestations of pulmonary TB and also TB affecting the central nervous system, lymph node, pleura, abdomen and the spine. In this session, we will be covering the other extrapulmonary sites which can be affected by tuberculosis and which could be of importance to a clinician. So, apart from other organs, TB can also involve musculoskeletal system involving the bones and joints of the upper and lower limbs, the pericardium, kidneys and genitourinary system, the skin, eyes, breast, larynx, ear, nose and throat. And the clinical presentation will depend on the organ system involved. So, coming on to TB of skeletal system, this accounts for about 1 to 3% of the total TB cases. Skeletal TB is usually a hematogenous infection with primary pathology in the lung. It can affect almost all bones. The spine and the hip joint are the most commonly affected. It can also affect the foot and hand bones, also the knee joint and the elbow joint. Shoulder joint may be rarely affected. Two main patterns of the disease are identified, the granular and the exudative. The exudative is also known as caseous. The risk factors for developing TB of the skeletal system include previous TB infection and also immunosuppressive conditions like diabetes, HIV, chronic liver and kidney diseases. So, TB of the hip joint. This accounts for 15 to 20% of the musculoskeletal TB. Though it can affect any age group, it is more common in children and young adults. This is a diagrammatic representation of the location of osseous origin of TB of the hip joint. These are the sites where the bacteria gets lodges first and then it starts the destructive process. These sites are acetabulum, femoral head or the epiphysis, femoral neck or the metaphysis and the greater trochanter. Patients present with swelling, pain and circumferential reduction of movements. Night cries may also develop due to relaxation of muscle spasm and unguarded movements. So, TB of the hip joint, there are various stages. Stage 1 is a stage of synovitis. This is of insidious onset. Patients present with pain and a limp, the so-called antalgic gait. There is fullness around the hip joint due to joint effusions. Movements are restricted and also there is deformity in the form of flexion, abduction, external rotation and apparent lengthening. The stage 2 is the stage of early arthritis where there is progressive bony destruction. Limb is flexed, adducted and internally rotated with apparent shortening. There is also pain, muscle spasm and atrophy. Stage 3 is a stage of advanced arthritis. The joint movements are painful, there is gross restriction of movements. The limb is flexed, adducted and internally rotated with shortening of limb. Stage 4 is advanced arthritis with dislocation or subluxation. The limb is flexed, adducted, internally rotated with gross shortening. There is bony destruction at the acetabulum or femoral head. The radiographic features which are characteristic to each stage. In stage 1, there is haziness of articular margins and rarefaction. In stage 2 of early arthritis, there is no reduction in joint space, whereas in stage 3, there is reduction in joint space. And in the stage 4, the pathological destruction at acetabulum or femoral head causes the wandering acetabulum. TB of the knee joint. Here the patients present with painful, swollen, tender knee which is warm to touch, with limping and reduced range of movements. There is fever, weight loss and anorexia with regional lymphadenopathy. There is synovial thickening, joint effusion and wasting of thigh muscles, and the deformity ranges from mild flexion to triple deformity. The severe form is triple deformity which includes flexion, posterior subluxation, external rotation and valgus the joint. TB of the ankle joint. This commonly affects children and young adults. There is slow onset, painful, swollen ankle with pain on weight bearing which causes a limp. There is also weight loss, anorexia and fever. Joint is warm, red, tender, boggy with regional lymphadenopathy and restricted range of movements. In advanced disease, there is calf muscle wasting, effusion, discharging sinuses as well as deformity. TB of the foot. This is also common in children and young adults. There is slow onset of pain and swelling of foot with a limp. Specific features will depend on the bones involved. For example, TB of the calcaneus will be presenting with a heel up limp and tenderness over the heel. Systemic symptoms are usually uncommon. Effusion, synovial thickening, deformity, discharging sinuses or a cold abscess are seen in advanced disease. TB of the shoulder. This is relatively rare and commonly occurs in adults. There is shoulder pain, restricted external rotation and abduction and wasting of deltoid and supraspinatus muscles. Depending upon the presentation, there are three types. Caries sicca, which is the commonest form and is also known as dry arthropathy. Type 2 is caries exudata and type 3 is caries mobile. There is also destruction of humeral head and glenoid cavity with muscle atrophy in advanced disease. And deformity is in the form of fibrous ankylosis with arm fixed in adduction and internal rotation. TB of the elbow. This can affect any age group. Patients present with painful swollen joint with effusions and synovial thickening. There is fever, anorexia, weight loss and lymphadenopathy. Rarely it may present as ulnar or posterior introitious nerve palsies. Proximal ulna is most affected, followed by distal humerus. There is wasting of muscles, deformity on flexion or extension and also dislocation in advanced disease. TB of the hand and wrist. This is common in children less than 5 years. Hand and wrist bones are painful and swollen with joint effusions. There is synovial thickening and movements are restricted. There is also fever, weight loss and anorexia. There is wasting of muscles, deformity and enlargement of digits or metacarpals, the so-called sausage finger or spina ventosa, and also sometimes discharging sinuses, cold abscess and compound palmar ganglia may be seen. TB of the heart. The most common manifestation is pericarditis. Pericarditis is seen in 1 to 8% of patients with pulmonary TB. TB pericarditis accounts for 60 to 80% of cases of the acute pericarditis in high burden countries and 75% cases of constrictive pericarditis. The symptoms are chest pain, shortness of breath with or without fever and weight loss or hemodynamic abnormalities. There is also evidence of pericardial effusion or constriction on chest X-ray, ECG or echocardiogram. If a patient presents with these signs and symptoms, he must be evaluated for TB pericarditis. So, the various stages and manifestations in pericardial TB. Pericardial TB can present as acute pericarditis, which is of insidious onset with fever, malaise, weakness, vague chest pain, orthopnea, ankle edema, cough and weight loss. A pericardial rub may be heard and in chest X-ray, cardiomegaly is seen. Pericardial effusion is also one of the manifestations and this is actually the usual presentation. Sometimes it may present as cardiac tamponade. There is severe distress, tachycardia and raised jugular venous pressure. A pericardial rub and pulsus paradoxus may also be heard. It can also present as effusive constrictive pericarditis due to involvement of visceral and parietal pericardium. There is constriction of visceral and parietal pericardium. There is cardiomegaly, pedal edema and raised jugular venous pressure. And also it can manifest as chronic constrictive pericarditis where exertional dyspnea, orthopnea, ankle edema and ascites sets in. Kussmaul's sign and pulsus paradoxus may be seen.